If you are over the age of 60 or have a loved one over the age of 60, which will basically be everybody will have a loved one over the age of 60, I want to impart on you in this video probably the most important bit of advice I can give you if that person is ever in the hospital. And I know that I've given lots of pieces of advice in my videos, but I would say this is probably the most important life-saving bit of advice, and it can apply at any age, but it's especially important over the age of 60. What am I talking about? Well, I am talking about being the best possible advocate you can be. Whether you are a husband, wife, child, parent, sibling, or even a trusted friend, when your loved one is in the hospital, be the best possible advocate you can be. And I'm going to explain why this is so important. But before I do that, I'm very excited to announce I've been working with my team for some time on a healthier, higher protein snack. Certainly better than most of the absolute junk snacks out there. Now, this is delicious. It is a treat. We have different flavors. We have cream and onion, which is also gluten-free, and other delicious flavors. Already had some amazing feedback. We use a pulse-based protein or a peanut protein, depending on the flavor. It is 10 grams of protein per packet, a good amount of fiber as well. And of course, zero sugar, zero seed oils. It's very unique. I have been eating it fairly regularly as well. So if you're interested, check in the links down below. Patient advocate, whoever it is. Why is it so important if you have a loved one in the hospital? To be at the bedside as much as possible and for as long as possible. I have worked as a hospital doctor for many, many years, and there's a striking difference between those rooms that you enter and there's loving family at the bedside, and those rooms where sadly somebody is alone for the duration of their hospitalization, and it strikes you even more at the extremes of age. Now, of course, not everybody is blessed to have a loved one at their side. For whatever reason, people's loved ones may not be nearby, or maybe they don't have any immediate loved ones. But the fact is that it can really make the difference between life and death. It is truly life-saving. I cannot overemphasize this. If you have a loved one in the hospital, to be at the bedside for as long as possible. And why is this so important? I mean, let's look statistically. The reality of hospitals and healthcare, and take it from me, as somebody who has worked internationally, I've worked up and down the East Coast in different hospitals, the problems are all the same. And I see the same recurrent patterns. Hospitals by nature are very, very busy environments. There's a lot happening and things can get missed. And despite the best efforts of many staff who are hardworking and dedicated, they don't want mistakes to occur. Mistakes happen all the time. And the difference with having a loving relative at the bedside who's watching over everything, double checking the medications, making sure that everything else is done on time, asking questions about investigations, about discharge date, and noticing, this is very important, if there are any symptoms which are occurring, if somebody doesn't look right, if somebody isn't moving around enough, if they're getting weaker. It truly is the difference between life and death. That's why it's such a blessing to have a patient advocate at your bedside, whoever it is, somebody who is watching over things like a hawk. And I find it fantastic and also inspiring. Whenever I see loved ones at the bedside, I usually thank them. In fact, I always thank them for being there at the end after I've spoken to them and answered their questions. I say, thank you for being here. This is great to see you at the bedside, because it really lifts the spirits of the patient up. And frequently the patient is not entirely with it either. I mean, think about it. You're in hospital, you're confused, you're not yourself. Having someone there to cheer you on really makes all the difference. And I don't think that any doctor who is worth their salt, any true doctor, should ever mind this. Every doctor should love it. Every doctor should be fully invested in wanting that patient to get better, get through their illness. And the more the merrier. If it was up to me, I would have no restrictions whatsoever on visiting hours, as long as it wasn't disrupting sleep or disrupting other patients. I'm all for it. This is a human tradition that goes back to cavemen days. When someone is sick, their loved ones gather around them. and are willing them through their illness. And let's face the truth here, the brutal, honest truth. I mean, the statistics are abysmal. In the United States, it's estimated that 250,000, that's 250,000, a staggering statistic, people die every year due to medical errors, and a fair percentage of them occur in the hospital. And I would hazard a guess that in a lot of those circumstances, if an advocate is at the bedside, it dramatically lowers the chances of bad things happening. And again, I'm not saying this to scare people. I'm telling you the truth because I've been a doctor for a lot of years, and this makes all the difference. And I want to give you some specific tips here as an advocate, what you should be doing. Number one, be there simply as much as you can. Your presence alone improves safety and morale. Number two, keep a written log. Jot down medications, test results, and what doctors say, as well as the names of doctors. You'll be surprised how often it helps clarify things later. Number three, ask questions. Ask lots of questions. The health and well-being of your loved one is simply too important. Understand the plan of care. Know what's being done and why. Don't let a doctor turn his or her back until you've got your answers. Number four, be firm if needed. Don't shy away from speaking up. This is too important for hesitation. Number five, stay observant. Notice every change, every symptom, every delay. I don't want you to worry one little bit, and I mean one little bit, about the feelings of the healthcare workers or think that you're being overbearing or they mind you being there. That is total nonsense. As long as it's a respectful environment, no doctor or nurse should mind a loved one being at the bedside. They should be cheering it on. This is a good thing. So do not worry one little bit about being there or think that you're getting in the way. This is too important, and you want the best possible outcome for your loved one. Another truth is that one day it could and probably will be you who is in that position. And it is an amazing blessing to have a loved one at your bedside. That's why it was so inhumane what happened during the pandemic when patients' families were banned from coming into the hospital. Totally unnecessary, should not have happened. Other precautions could have been taken if necessary. That was absolutely terrible, but I'd like you to think about this very carefully, because one day any one of us could find ourselves in that hospital bed where we are sick, anxious, vulnerable, or not in our full capacities. In that moment, having someone who loves you, watching over things, asking questions, and refusing to let anything slip through the cracks will save your life. Medicine may have advanced in many ways over the last century, but let's be honest here, because the most powerful force of all is still human presence. Machines can monitor your vitals, but they can't care for your soul. Algorithms can alert staff, but they can't notice the small things only someone who knows you can see. Be there, stay alert, ask questions, protect them. Whether you are a wife, husband, child, parent, sibling, or even a trusted friend, that can literally be the difference between recovery and a bad outcome or even tragedy. That is my number one bit of advice to you if you have a loved one in the hospital, especially at an older age. Thank you everybody for watching. I do appreciate that. Feel free to share your stories down below. Have you been a patient advocate? Have you noticed things happening in the hospital which have averted tragedy? Do you regret not being an advocate? Share your stories if you're comfortable down below. Check in the links down below again for my website, all the other work I do, my health program, and also, as I said, our newly released protein-based snack, which we're very excited about. That is on our website, ohiwellness.com. Hit the like button if you like this video, the subscribe button for more similar videos in the future. Do share this video with anyone else who may benefit. And if you enjoyed this video, you will also enjoy some of my other videos on how to navigate healthcare safely. We'll speak again very soon.